Now we'll discuss about pulmonary function measurements. Pulmonary function tests are non-invasive tests that show how well the lungs are working. So how these tests are performed is three basic types. That is ventilation, distribution and diffusion. Ventilation means measurement of body as an air pump, ability to move volume of air and speed. Distribution measurement provide an indication of where gas flows in the lungs and whether or not disease has closed. Diffusion measurement test is lung ability to exchange gas with the circulatory system. Usually this requires the patient to take the deep breath and then exhale as rapidly and completely as possible. So the residual volume is measured indirectly such as with the nitrogen washout procedure. So diffusion measurements identify the rate at which gas is exchanged with the bloodstream. So here the pulmonary function can be accessed by means of two major classes, that is evaluation of mechanical aspects of pulmonary function, evaluation of gas exchange or diffusion at the alveoli. Respiratory volumes. So here tidal volume, that is the volume of gas inspired or expired during normal quiet breathing. Minute volume means volume of gas exchanged per minute during quiet breathing. Alveolar ventilation means the volume of fresh air entering the alveoli with each breath. Inspiratory reserve volume means the volume of gas which can be inspired from the normal end tidal volume. So IRV is equal to Vc minus Tv plus FRC. Expiratory reserve volume means the volume of gas remaining after a normal expiration less the volume remaining after the forced expiration. Respiratory capacities, that means functional residual capacity, the volume of gas remaining in the lungs after normal expiration. Total lung capacity, that is volume of gas in the lungs at the point of maximal inspiration. Vital capacity, the greatest volume of the gas that can be inspired by voluntary effort after maximum expiration. Dead space means it is a functional volume of the lung that does not participate in the gas exchange. There are three types of tests for single breath category, that is test that measures expired volume only, test that measures expired volume in a unit time, test that measures expired volume or time. Normal results, that is normal values are based on your age, height, ethnicity and sex. So different measurements that can be found on your report is diffusion capacity to carbon monoxide DLCO, expiratory reserve volume ERV, forced vital capacity FVC, and these are the measurements, that is low vital capacity, total lung capacity, residual volume, functional residual capacity, all these things. So what abnormal results means that is you may have chest or lung diseases. So lung disease means asthma, chronic bronchitis, infections. Other lung diseases may the lungs scared and smaller so that they contain too little air. Examples of these illnesses is extreme overweight, pulmonary fibrosis, muscular weakness, and the main risks is small risks of collapsed lungs in people will certainly type of lung diseases. Spirometer. So spirometer is a standard test doctors use to measure how well your lungs are functioning. So in our to take a spirometer test, you sit and breathe into a small machine called spirometer. Spirometer tests are used to diagnose these conditions: COPD, asthma, restrictive lung diseases, other disorders affecting the lung function. So spirometer is often done as a part of a group of tests known as pulmonary function tests. It's rarely used alone with the diagnosis of lung condition. So this can help to determine if the treatment is working or needs to be modified. Spirometric side effects. So few complications can occur during the spirometry test. So in very rare cases, test may trigger several breathing problems. Interpreting results means since the results of a test are immediately available, your doctor will likely be able to review them with you at your appointment. So spirometer provides two important measurements: forced vital capacity and forced expiratory volume. So when the doctor is satisfied that just results are valid, the information will be used to determine if lung function is normal or abnormal. So abnormal results indicate one of three possible breathing patterns: obstructive, restrictive and combination of both. So here is the waveform which shows the results, volume and health. If it is time, it is healthy, and FVC, that is forced vital capacity, and forced expiratory volume. Thank you.